Hi, everybody. Good morning. Thank you for coming. The first kind of rule of business before we even call the meeting to order is Dr. Burley unfortunately is not able to be here this morning. So I'd like to elect the chair pro tem. Somebody just to run the meeting today. I will help you in the background and do everything you need. But we need a nomination and a second for a chair pro tem this morning.
I'll now nominate Dr. Klinsky.
Aren't you sweet?
I'll second that.
What is it that you want me to be doing for you next?
Very good. No, I got a first and a second by Dr. Orchard as well. So just the nomination today is to elect Dr. Klinsky as chair pro tem in Dr. Burley's absence. I'm going to just say thank you so much in advance.
No worries.
Thank you. Yes.
Yeah, no worries. Okay, so you're gonna call it to order or am I?
Yes, I can. We'll call the meeting to order this morning. It's 8:35.
All right, so next we have public comment. Any member of the public may address the subcommittee for a period not to exceed 3 minutes on any issue not on the subcommittee's agenda. The MAC will listen to all communications but may not take action. Are there any public comments? Nobody on Zoom? Okay, so now we need approval of the past MAC meeting minutes from March 8th. Take a motion to approve.
Motion to approve.
A second. Okay, do you want a formal vote or
Yes,
just
I'll
any
do a roll call.
opposition?
That was Dr. O. That was the, okay. Let me do a quick roll call. Dr. Klinsky.
Aye.
Dr. Orchard.
Aye.
Christy.
Aye.
Jamie.
Aye.
Cassie.
Aye.
Carrie
Aye.
/ David. Chief Reyes.
Aye.
Josh.
Aye.
Rachel.
Aye.
Jeff.
Aye.
I missed anybody. And Chief Watkins, not a voting member yet, but we do recognize you in the room. Hearing none, motion carries.
Okay, correspondence is none, so that we get agency reports. Teresa, I think you have the first one on A.
Attached to the agenda packets is a report for the update on the EMS agency. One thing that I would like to highlight is that the EMS agency is releasing a SWOT analysis. We want to gather input from all of our stakeholders from the entire system, but we'll also post it on Facebook so that we can reach also field personnel that normally, we don't get that opportunity. So we want to cast as wide a net as possible. We conducted one SWOT analysis back in 2021, and so it's time to update it, especially as we engage in system design. We want to be better informed, and once we get the results, I think that they'll very likely we can bring back the results at the July meeting. I'm happy to answer any questions. If there are any ideas, anything you want to share with us or suggestions, please do email. We love the feedback. We love the ideas. And we like I said, we want to make sure that we get cast the widest net that we can, and that we ask the right questions. So if there's a specific areas that we need to focus on, by all means, do let us know. But definitely this week, that SWOT analysis will be released.
Thank you. B, Mohawk.
Dr. Klinsky, do you mind if we just go back to one and just do introductions? Just
Oh,
for my sake, I missed
Sure.
it. I apologize. And I have to do the minutes, so it will
Go for it.
really help me for those on the call. So I wouldn't mind starting. I'm Jesse Aller with the EMS agency.
Justin Reyes, Division Chief, Monterey County Regional Fire. Jeff Watkins, Carmel Police Department Chief.
Josh Severiano, firefighter at Greenfield.
Michael DeLeo, Battalion Chief, EMS Coordinator, CAL FIRE.
David Thompson, ED Manager at Salinas Valley Health.
Terry Campman, Salinas Valley Health. Teresa Rios, EMS agency.
Christy Zableski, Emergency Department Director at Chomp.
Michelle Kalinsky, Chomp.
Derek Orchard, Natividad.
Rich Nealand, AMRCDS.
Jeff Warner, Program Director with CalSTAR, representing our ambulance.
Cassie Calderon, Natividad. Jamie Kilbar. Memorial.
Remember.
And we'll start in the back, sir.
Mike Eslinger, I'm the Regional Director with AMR and CalSTAR. Steve Brooks, EMS Agency.
Deborah Hopgood, EMS Agency.
Rita Moreno, EMS Agency.
Kimberly Hernandez, EMS Agency. You want your Zoom?
And then those on the phone, please.
Carlos
Silas Fisher,
Vega.
Monterey Fire Department.
Carlos Vega, Marina Fire.
John
Nick
Mullen,
Hall,
Trumbull Fire.
Fire. Nick Hall, Seaside Fire Department.
Anyone else? Okay, so then we're back to being Mohawk.
Okay, thank you so much.
No worries.
Appreciate that. The Mohawk, I'll give that report this morning on behalf of myself and Deborah in the room. Mohawk was very busy in the last couple months. As you are well aware, the Pineapple Express storm came on the heels of the storm in January. That kept the Mohawk extremely busy. We were activated in the EOC under the Med Health branch. And the Mohawk unit, because the duties were at the peak of the incident, because they were so complex, Deborah and I kind of split some of those Mohawk roles. She took very much the health aspect, and I took somewhat of the medical aspect. So Deborah focused on the care and shelter and keeping up some of the Med Health folks to staff that, which included behavioral health. That was an incredible lift in itself and took an incredible amount of focus. And so we are still activated just at a very low level to kind of support some of the efforts as we start to recover. My role primarily focused on the medical, which was the operational side. So again, we came up with a plan in case the peninsula was to become an island. That was helpful, but what was really helpful from that is we took that plan from January and we built it out even further with some of the hospital folks, especially with staffing needs to build that out even further if we did need to get folks across that flooded riverway. And so I think that was really helpful. We were able to kind of make some good headway in the EOC. It kept us very busy. We were happy to have you guys as partners all along the way. And we're good with Mohawk for a couple months. If we could kind of focus on other things, that'd be great. So with that, any questions that you guys have for either myself or Deborah, Chief?
I have a question. So the public agencies, when these emergencies get declared, are capable of getting reimbursement either through FEMA or through the state. Do any of our private partners, the hospitals, the ambulance provider, is there any funding for them to be reimbursed for their upstaffing and stuff like that? Or is it only for public agencies?
That's a great question. So as far as the upstaffing and for fire, I believe those were state OES resources.
And we're also going through the FEMA reimbursement as well.
Your personal.
Yeah, so the OES is when they pre-position stuff, that's authorized to the state. But we also did upstaffing at the stations that we're seeking FEMA reimbursement for as well.
That was, maybe we can offline that conversation, but if there's a way that we could support hospitals or private folks through that, we'd love to do it, but.
Unless they're not interested in it, I'm just curious.
I don't know though, as we stand here, so maybe.
Yeah, we obviously are always interested in getting reimbursed whenever we put up resources specifically to the incident. We do need though, is that at the time that it's requested, we actually have to get a state a request number. So it has to be we have to at least get something that applies that it's not, it's a resource that's put in for the disaster itself. We don't always get approval for payment, but we typically have to get some type of authorization. Like we don't even, put together the forms if we don't have the authorization number in advance.
In the EOC realm, there was some resource requests that came for ambulance strike teams. One was out of county, which is of course reimbursable to the incident. There was some ambulances that we needed to staff some of the shelters. We tried here locally, that didn't kind of pan out. So we ended up using some other BLS assets, Royal Ambulance from Santa Cruz. But there were some asks to kind of fill some roles that weren't able to be filled. And I do believe that AMR, I can't speak for the hospitals, but I know that AMR tried to keep as high as staffing as possible, didn't drown anything out. But I don't think any additional units were added per se.
I think we did in the first couple of days, which we're willing to support, by the way, but typically if it's something that's going to go on for an extended period of time, we would absolutely request that we can somehow get a state number that we can get authorization for.
We'll offline that as a Mohawk item and we could follow up on private reimbursements and ahead of the next incident.
Okay, no other questions on that. We'll go on to C, ambulance patient offload times.
Morning. There is an APOT report in your agenda packets, but just I'll kind of summarize. So we're reporting on February and March. And there were some increases in the 90th percentile at Salinas Valley and Natividad for February. The times dipped back down into March, but the overall or the average wasn't affected very much. I do communicate with all the hospitals every week so that they can see those outliers and look into them, but the outliers are what kind of shoot up 90th percentile. Any questions on APOS?
Okay, great. So then we're moving on to project updates. It looks like A is health data exchange implementation. Jared.
Okay, let me just give a quick little update on HDE. We are still working with Chomp, business application manager, and leadership to present this project HDE to their domain council. So we'll follow up with that gentleman. Natividad, we're currently working with their IT department and leadership as we refine some of the data flow and required fields. That's been moving along very nicely. We're still working with me's IT manager and leadership, hopefully to set up a meeting. And thank you very much, Jamie, for starting that dialogue with us. And then Salinas Valley Health, we are bi-directional and good to go.
Excellent. Okay, any questions on that? If not, it looks like B is the 2023 policy protocol review cycle. Steve.
Sure, it's taking more time to walk up there. The 2023 cycle is coming to an end with the policies being in effect on July 1. We are currently working with our app developer to get everything up and running on the app, and that will be in place probably the second, third week of June, definitely by the 1st of July, and then in that same time frame, we'll be adding it all to our website. The only thing that's really happening now is we've distributed everything for training, and our agencies should be doing their training.
Any questions?
I have a question about the app, Steve. The update to the app gonna be able to be used without connectivity? Is that something? No. Okay.
It's being looked at and talked about, but it's not a feature of the app that it's a native information on the app. It does need internet connectivity.
Okay. So C, Tri-County MSP paraffin close up. Jared, that's you.
Okay, Jesse. We had a desire to start this on April 1st, and I guess maybe the fools was on us because there was a couple delays. But we're excited to kind of report today, and I'll let Rachel kind of chime in as well. The delays were really twofold. One was procuring the drug itself, and then two was there was a couple other layers of state approval that we needed to get. We're using Highland Hospital because Bupe is a base hospital physician order. There were some issues with having to be X-waivered at that time, so we chose Highland because it's a tri-county effort to kind of give that base hospital direction with the desire of someday kind of using a base hospital in one of our tri-county areas. That agreement with Highland is still kind of going through the legal process and is not in place. So as a stopgap and so not to delay the delivery of Bupe, we created a 7-digit number. It's like a 18774 EMS Bupe. And that number won't change even when we use Highland. So the paramedics right now can use that number once we go live. And that number is being rotated through various physicians right now. So that physician kind of group needed state approval, which we got. So we were just trying to, out of abundance of caution, making sure we're doing everything right. But I'll let Rachel chime in and then I'll talk about the go live date.
After jumping through all the extra hoops that we discovered, it just came in. So we have enough, we're ready to deploy. I don't know the status of Santa Cruz and San Benito, but I imagine they've got to be on a similar timeline. So whenever you guys want to have all three of us start, we're ready.
you want to talk about some of the hoops you were?
So there was, I know that there was some forum that our narcotics supervisor had never heard of before. And I think even Dr. Yellen, I don't think that they knew about it and they had to sign that. And then it went through. And then they told us it was too much. They didn't understand that we were trying to order for our initial deployment. So then it came back to us. And I think the fourth time was a charm. So we finally got it through and it just arrived.
As far as the go live date, because this is a tri-county effort, we really want to start at the same time with Santa Cruz and San Benito, and that should happen soon. I will get with Dr. B and Teresa and Deborah and leadership, make sure that we have kind of a thoughtful memo that's ready to go, the policies are ready to go, and that any other things we need to do is buttoned up. And again, this project will affect AMR only for the first year, until we kind of refine it, open it up, make it better, and then tweak it. But expect some updates from either Dr. Close or myself as we kind of go along and are excited to share some of the QI aspects of it.
Any questions? Otherwise, the
take-
MAC nominations goes to you to be just.
Okay, I'll take the next two, Doc. So we have, this is maybe always going to be an agenda item is nominations. We have two to bring forward today. One is Spencer Harnett with AMR, paramedic FTO. His bio is within the minutes. And then also Philip Brown, registered nurse from CHOMP, to be taking your place. And you'll be, Christy, going into that alternate role. Not to minimize, thank you so much, by the way, for your dedication on this committee. And you're not out of it, so we're not gonna say our goodbyes, but those are the nominations in front of you. And then maybe we should get a roll call on those itself, and then we can talk about the get another vote on the terms moving forward. So the first looks like we just need a vote for Spencer, Philip, and then Christy moving into the alternate role for Matt. We could just get a nomination in a second for those.
Any seconds?
Okay, let me just do a quick roll call. Dr. Klinsky,
Yes.
Dr. Orchard,
Yes.
Dr. Greenson,
Yes.
Christy,
Yes.
Jamie,
Yes.
Cassie,
Yes.
Carrie,
Yes.
and when Carrie's not here, obviously it's David, so I'm not trying to minimize you, David. Spencer, you cannot vote quite yet. Chief Reyes.
Yes.
Justin. I'm sorry, Josh.
Yes.
Rachel,
Yes.
Jeff,
Yes.
and Chief Watkins, not a voting member, but we recognize you as well. Motion carries. The second item, Doc, is the terms for a handful of us, which is Dr. Klinsky, Dr. Hawthorne, Dr. Greenson, Philip now, Jamie, Casey, and then alternates, Dr. Close, Dr. Darger, Christy, Michelle, and Chelsea are all expiring at the end of June, but have graciously committed to continue their service on MAC for another 2 years. So we just need a nomination to continue. And then also Dr. Orchard, I wasn't quite sure. I know you had a meeting yesterday as far as your,
I'll get back to you.
okay, so
When's
we'll
my-
table those two.
Yeah.
Your term technically ends at the end of June. And so I think our next meeting is July. But we can button up some things in the meantime and vote on that in July. Okay, thank you so much. So if we can just get a motion to continue those in a second, I'll do the roll call, Doc.
I motion to continue.
1 second.
I'll do a quick roll call. Dr. Klinsky,
Yes.
Dr. Orchard,
Aye.
Dr. Greenson,
Aye.
Christy,
Yes.
Jamie,
Yes.
Casey.
Aye.
Carrie,
Aye.
Chief Reyes.
Aye.
Josh,
Aye.
Rachel,
Yes.
and Jeff. All right. Motion carries. That is both of those stocks, so we're down to.
No questions, nothing else on that. It looks like we go to new items for discussion. Steve, 2024 policy and protocol review cycle.
Yes, let me share my screen here. So you all have seen this memo that came through your packet for this meeting. And EMS agencies begun the 2024 policy cycle. So we started early, we started last cycle early so that we could make sure that we have adequate time for public comment and participation without it being over the holidays as it had been in previous years. So we've started looking at which policies are on cycle, and these are the ones that are on cycle. We have quite a bit of important policies, the scope of practice policies, hospital communication policies, looking at our stock policies for ALS and BLS, some of our procedural policies, and then a variety of cardiac and other protocols. So these are going to be coming to you with some measure of revision and distributed for public comment after the July meetings. So close this. It's not quite- Anyways, I'll show you the next slide. So this is the general calendar that we'll be looking at. And right now we're here in May, where we're working with our internal team to put it all together to format it. And we're bringing it to MAC to start this week, the specific policies, because last meeting I told you this was coming. And then in July at MAC, we'll be bringing everything forward to you and then releasing it for public comment after that. That's the next steps of the process. You can see that we've got in August, September, a lot of public comment opportunities. We're continuing what we were doing before, where we have both written public comment as well as opportunities to hear comments in person. And then, without boring you with all the details, we'll be coming in January for a review of the public comments, and then before this committee in March for final endorsements, so we can send them out again for training in April, and then training and the app development, so a July 1 start date. So that's what we've got going. Any questions? All right, well, thank you very much.
Okay, then moving on, we have EMS System Quality Improvement Program. Looks like A is continuous quality improvement advisory group report.
Blake's not able to make it today, who would normally be giving the report, so I can do that. The STEMI stroke and trauma QI committees have not met since the last meeting of MAC. CQI TAG did meet at the end of April. Just to hit a couple of highlights, quality improvement plans from various agencies and hospitals are due by May 30th. This was put on hold for an extended period of time due to COVID-19 pandemic, and this is our, now that the state has lifted that, we're getting back on track with that. So everybody has a QI plan due this year. And then as a reminder, annual updates will be due on the go forward on January 31st of each year. And then a new plan is due every 5 years. So if you have any questions or concerns about that, please reach out to Blake. I know he's been working with several agencies to help them through their plans. Otherwise at CQI TAG, we reviewed some data related to ketamine. Blake has started doing some individual follow-up with agencies to give feedback, both positive and areas for improvement for individual providers. And then we also reviewed our 2022 core measures. That I think is it. The only other item is that the STEMI and stroke summits that we talked about last time have now been canceled by the state. And then we have upcoming meeting dates for all of the QI committees in June. The dates are on the report available in your packet.
Any questions? Otherwise, future agenda items. Anybody have anything to add to the future agendas?
There was one item that came from Fort Hunter Liggett last meeting. that's just kind of a rolling item. They wanted to do a presentation once their MOU was finalized. So I'll follow up with Devin accordingly.
So if nothing there, then we have announcements in good of the order. Any member of the committee may make announcements or comments. The MAC may not discuss or take any action on any item raised during the announcements, except to decide whether to place the matter on a subsequent agenda. Any announcements? Next meeting date is scheduled for Wednesday, July 12th at 8:30. Location and Zoom to follow. And then, do I need to have a motion to adjourn? Or can
No,
we just
But
adjourn?
thank you. And there's some donuts that Kimberly brought. So if you guys want to grab some of those.
Okay.
Thank you so much, Dr.
Ah, thank you guys.
Meeting adjourned.